So for those of you that I've not met yet, my name is Nava and I'm here with Tina today, and we're both resident physiotherapists at Foundation Physiotherapy at the Front Street location. So before we get started, just a little bit about us. So I grew up doing competitive figure skating, and this is kind of what initially sparked my interest in starting a career in health and wellness and fitness. And I've been weightlifting for about 5 years now, and I also worked as a personal trainer before completing my master's here at U of T. And when I'm back home in Vancouver, I love going for hikes and runs. And in Toronto right now, I guess I just enjoy scoping out new taco and donut shops.
Hi everyone, my name is Tina. So I graduated from U of T with a Master of Science in Physical Therapy. I also graduated from Western for my Bachelor of Medical Sciences. So I am a Mustang at heart. And if anyone is also a Mustang, please comment in the chat box. So I've been doing general weightlifting for about 8 years in total. And I dipped my feet a little bit in powerlifting, but then I found Olympic weightlifting and I kind of fell in love. So I've been sticking to that for about 3.5 years, and I'm still currently doing that. In terms of my hobbies, I mean, there's not really much you can really do in the middle of a pandemic, but as you can see, my beautiful dog over here, I give him lots of cuddles and playtime. So that takes a lot of my time besides working. So welcome.
Okay, so this is just a quick overview of today's session. We're just going to go over the steps to mastering the push-up to help you get stronger and, again, prevent any unnecessary injuries down the road. We'll also be going over certain modifications and other helpful tips if you are currently experiencing an injury, but you want to return to doing push-ups. And just out of curiosity, how many of you guys are learning how to do your first push-up on the floor versus how many of you are a bit more experienced but want to hone in on your technique a little bit more? Put that into the chat box below.
Okay, and while you guys comment that, I can't really look at the chat box, but I'm just going to continue. Okay, so I found this quote not too long ago while I was reading a book. Unfortunately, I don't really remember the author, but it says, no matter how advanced you are as an athlete or a mover, the best way to keep improving is to master the basics. Now, this quote really resonates with me because I truly believe that mastering the foundations will make you a better athlete. I mean, I do work at Foundation Physiotherapy, so that in itself is a pun, but I believe that, mastering the basics will help you with any of the more advanced variations. For example, our webinar today is about the push-up. So the push, so anything with a push, it's the advanced variation. So the bench press as well as the overhead press. So mastering the push-up will help you more in those exercises. So for example, a baby doesn't learn how to walk until it learns how to crawl. So it's sort of the same principle. So there are 5 fundamental movement patterns. There's the push, there's the pull, there's the hinge, there's the squat, and there's a loaded carry. This is where we're gonna kind of create our webinar series around. So if you look at the push, today is gonna be about the push-up. So the push-up is the foundational movement of all push exercises. Then our next webinar is gonna be about the pull-up, so you can tune in for that. And then with the hinge, it's gonna be the deadlift, the squat, and then the loaded carry, which is something like a farmer's carry. So again, something I want you guys to comment in below, who has participated in a push-up challenge in the beginning of the pandemic? I know all of you guys had, maybe some of you guys had, I definitely have, maybe some injuries or hope not, but that kind of answers the first question. So why do push-ups? It's an excellent body weight exercise to do at home. It's great to strengthen your upper body, and you can actually make it very complex if you want to make it a little bit more harder. And given the fact that we're kind of in a pandemic still, and doesn't seem like gyms are opening up anytime soon, it's a great exercise to add into your programming. Second is the most fundamental and basic form of pushing mechanics performed in the gym. Like I said, the push-up is the foundational exercise of a bench press as well as an overhead press. While we were designing this webinar, I actually had a friend message me saying that while doing push-ups, he's noticed that his bench press actually has improved. So that is a huge benefit for still doing push-ups, even if you are an advanced athlete. Third, technical faults in push-ups can present in more advanced push exercises. So I'm gonna go a little bit more in detail with this, but with a push-up, you want to create proximal stability. And what that means is you wanna engage your abdominal muscles and your glutes. So when you do that, when you do that with technical, so I'm going to repeat myself, sorry. When you have some proximal stability, if you were to do it incorrectly in a regular conventional push-up, it's going to be a lot harder for when you do an overhead So that's going to show a little bit more because an overhead press is a lot more complex. So with number 4, it has transferabilities with many aspects of life. For example, if you're pushing a grocery cart or a baby stroller, if you're stranded in the middle of nowhere and you need to push your car, hopefully that doesn't happen to any of you guys, but this is an example of what the transferability it has in regards to the push-up. So there's a lot of strength requirements when you do a push-up, but it really depends on the variation you try. So in general, push-ups require activation of the pec major, so your chest muscles, your triceps, and your core. So these are primary movers. Obviously, you also need some shoulder stability because you are doing a weight-bearing exercise. As you can see right over here, these are all the exercises that helps with the shoulder and your shoulder blade muscles. So steps to mastering the push-up. This is probably the most important part of this whole presentation. So we want to hone in the positioning. So we're going to go a little bit about each part of this in more detail. But if there's one thing I want to kind of tell you guys, always prioritize quality over quantity. I mean, it really depends on what your goals are. But if your goal is to strengthen your upper body, you want to do it in a more controlled manner. I see a lot of people repping 15, 20 repetitions of push-ups, but their quality is sloppy. Like, you're not really getting the best bang for your buck. Rather than doing 15 sloppy push-ups, try to hone in 5 really good push-ups, because that will also set yourself for success when you do any more advanced exercises. For example, if you're a power lifter or a bodybuilder, you want to do more of the overhead press, for example. Oh, and also this also applies to all my clients. So I know there's some clients here, I recognize some names. If you're doing your rehab exercises, the same principle. You want to do things in a nice controlled manner. Don't just rep out because we said 10 repetitions. Okay, so the first part of the positioning is a high plank position. So as you can see here, Nava is engaging her glutes and engaging her core. So you can see the line over here goes from her upper back all the way to her glutes. And there's a nice line. She's having a nice neutral spine. Neutral spine is what we want to have with most exercises that we do, with the exception of a Jefferson curl, obviously. So common mistakes people do, or common faults, is, as you can see on the left-hand picture, the bum is too high. So when the bum's too high, you're not engaging your glutes, and it affects that proximal tension. So proximal stability creates distal mobility. And the next one is an anterior tilted pelvis and an unengaged core. So as you can see in the second picture, Nava's back is arched. And when it's arched, your abdominal muscles are lengthened. And when your abdominal muscles are lengthened, you're not engaging your core. So some of you may have back pain when you're doing push-ups. This might be the reason, because as you can see, all that load is being pushed into the spine. So you want to kind of have that neutral spine that we're seeing here. It's the most ideal version of a good push-up. And then thirdly, this is unengaged core. I don't see this as often, but it's still pretty common. As you can see here, the glutes are kind of propped forward, and all that load is being placed on the upper back, and you can see the back being rounded upwards. So now you have to work a lot harder. Secondly, let's look at the hand positioning. So ideally, you want your hands to be shoulder width apart, straight ahead, so neutral, and fingers spread apart. So let's look at this finger spread apart part. The reason why we do that is because you want to distribute your weight a little bit equally. So rather than having all the force being distributed either in the inner part or the outer part, it's distributed equally, so there's not more force and more shear forces in that one region. I said force a lot, I'm so sorry. And secondly, you want to look at where your hand is positioned. So you want it to be in that neutral position, especially if you are starting out. So this webinar is mostly going to be talking about the conventional push-up, as many people, especially if you're not really used to doing a push-up, we're going to be talking about the conventional because I think it applies to most people. So if you're not that experienced, the reason why we want to do the push-up in that neutral position is because we want to create something called an external rotation torque. Now, some of you may have heard that before, some of you may not. I will be talking about this torque concept a little bit more in the future webinars. But with regards to the push-up, what an external rotation torque, I'm going to try to demonstrate a little bit if I can. So if you can think of this as the ground, my arms are positioned flat. My hands are active. They are not passive. They're not just propped like that. They are actively engaging the floor. So then I'm going to try to create an outward force. So I'm almost trying to bring my shoulders and my elbows and my wrist into that kind of force. You're almost trying to bring the floor into that rotation outwards, but you can't, because even the movement itself will create some stability in your wrist and your elbows and your shoulders. So that's why we want to do that. So as you can see, one of the first faults is I see people doing is having their hands rotated outwards. That will prevent you from creating that external rotation torque. And if you were to try that at home, you would see that. Secondly, are people doing their hands inwardly rotated, so a little bit like this. And the reason why that can be, I mean, there are exceptions obviously with the diamond push-up, but the reason why I'm not a huge fan, especially if you're a beginner, is because one, you can't create that external rotation torque, and two, when your hands are rotated inwards, it can cause some compression in the front of your shoulder. So if you're a newer person when it comes to push-ups, you want to have that upper body strength, that rotator cuff stability before you do something like the diamond push-up.
Okay, moving on to the next point. So we want to make sure that our shoulders are on top of our knuckles, like the image on the right side over here. When our hands are too far apart, this can put a bit more stress on the structures in the front of the shoulder, like Tina mentioned, and again, increase the chances of flaring our elbows, like the image on the left-hand side. So in general, it is ideal to place your hands around shoulder width apart for the conventional push-up. Again, there are always exceptions to this rule for more advanced variations. And then going on to elbow flaring. So when we talk about flaring, it basically means when the angle between our arm and our body is greater than 60 degrees. So like the image on the left side over here, this shows me with an elbow flare on the very, very left side. There we go. So we ideally want our arm to be kind of either in line with our chest fibers, like the middle picture, so at around a 45-degree angle, or a bit tucked in super close to our body just to bias the triceps a little bit more. So again, when we flare our elbows, this will cause our shoulders to rotate more inwards. And again, this can cause some discomfort and irritate the structures in the front of the shoulder, as well as put it in just a more compromised position. It can also cause a little bit of discomfort to our elbow joint because you are rotating more at the elbow, and that'll put a bit more shear force in that area. And again, Tina will be talking more about this later on. So again, aim to keep the angle below 45 degrees and think about keeping your elbows tucked in closer to your body. So again, more so for the conventional push-up, we want to try and keep our forearms vertical. So this basically means that there is a 90-degree angle between our forearm and the arm, and it would almost be like our forearm is pointing upwards towards the ceiling as if there's an imaginary line, rather than the picture on the left-hand side. As you can see, my forearm is pointing a bit more backwards, and the angle is a little bit smaller between my forearm and my arm. So one way that you can help facilitate this if you're having a harder time is you can place either a roller, a dumbbell, honestly anything, just to use it as an external block and control the movement of your forearm so it limits kind of how far back your elbow is moving. Again, always exceptions to this rule because the amount that your elbow changes can change depending on the different push-ups that you do choose to perform, but this is probably the most basic place to start off with. Another common mistake that we tend to see is either a hyperextended neck, so the picture on the top left side, or a hanging neck, the picture on the bottom left side. So when we crank our necks a little bit more upward, this can put a little bit more stress in that area, as well as, again, potentially affect the control down the chain into our lower back region because the spine is all connected anyway. So basically, if I'm arching through my neck, then there's a higher chance that I'll also be arching through my low back, and this will decrease the overall amount of tension in the body, like Tina mentioned in the previous slides. So again, sometimes we'll also see people hanging their neck downwards, and again, a lot of the times that's just because they're not using enough of their stabilization muscles. Again, ideally trying to keep our necks in more of a neutral, straight line, in line with the rest of our spine. Lastly, we're going to talk about the shoulder blade. So lots going on in this slide right now. Basically, to start off with, we want to try and keep our shoulder blades nice and flat over the rib cage in the top position, like the image over here. And then when we're at the bottom part of the push-up, we want to let them come together and squeeze to create tension in the muscles. So again, you want to make sure that we are moving through the full range of motion rather than just kind of doing little mini push-ups by just bending and straightening the elbows. So trying to get the chest all the way down to the floor as well when we're in that down position, like is shown in the first image over here. We want to make sure that we're actually squeezing our shoulder blades together, which is not happening in this picture. Again, another common fault that we see is shoulder shrugging, and this will tend to happen a lot when people start to fatigue. So this will shift the tension to our neck muscles and take away from our chest and arms. So try your best to, again, focus on keeping the shoulder blades down and away from your ears, because this can help create some more stability in your shoulders and tension in your target muscles. And again, so image number 3 over here. Again, it's important to know that you don't always have to keep your shoulder blades glued together for the entire movement, which is a common misconception. You want to let them to come apart as you move away from the floor and as you're coming upwards. Okay, so we're just gonna pull up a quick little video just to summarize everything that we talked about. So again, we wanna start off the push-up by creating good tension in our trunk and proximal region. So squeeze the bum, engage your abs, and try and keep a neutral spine all the way up from your neck to your low back. And basically this means don't arch it too much and don't round forward too much. And again, ensure that your hands are about shoulder width apart and that the shoulders are on top of the knuckles. As you are lowering, keep the tension throughout your body. So don't lose that core tension, and try and keep your forearms vertical, which again, I could probably do a little bit of a better job here, and try to minimize any elbow flaring. And as you can see, you want to squeeze your shoulder blades at the very bottom and let them come apart at the very top. So squeezed and then coming apart. Okay. So these are just some examples of accessory work that you can do to add into your training routine to help you master the push-up. So for instance, if it feels like your shoulders are fatiguing super quickly, try to incorporate some bottoms up kettlebell holds. So this is what Tina's doing in the picture over here, or shoulder external rotation type exercises, wall slides, it can be anything. Again, how many of you guys, I don't know if you noticed or not, have some shoulder blade winging? Put that into the chat box, because I know for myself, when I do push-ups sometimes, I will get a little bit of that winging. So I can focus on, more so for myself, doing some serratus exercises to help with my shoulder blade control. And this can be push-up plus or serratus punches, for instance. But again, keep in mind that some people have different reasons that may be contributing to their winging. It could be other shoulder blade muscles that are contributing. It could be tightness in other muscles that are causing the winging. So this is where, again, coming in for assessment just to see what is potentially contributing to your winging can be super helpful. Again, if you're having difficulties engaging your core and glutes while you're doing the push-up and you notice your back is arching, for instance, at any point, then you might want to consider incorporating more isolated glute movements such as a glute bridge or any other core exercises. And again, I think people always think that the push-up is just a chest and arm workout when it is essentially a moving plank. So you want to kind of focus on finessing that movement first. So what you can do is even try and hold a forearm plank for about 60 seconds. And then once you're able to do this, then you can move on to the more dynamic movements of a push-up. So incorporating things like hollow rocks or bird dogs, for instance. And again, keep in mind that for all of these exercises, it's important to know that how you're doing them is essentially probably even more important than just doing these exercises with poor technique, for instance, because when you have good technique, then you're making sure that you're engaging the right muscles in the right way. And this can actually help you create more stability and strength in the long term.
Awesome, Naba. Okay, so let's talk a little bit more of the common injuries and regions of pain. So before we get started, how many of you guys have experienced some sort of pain anywhere around your body when doing a push-up? Can be even some discomfort. I know I have, so you can go ahead, comment that in the chat box below. I can't really see who's commenting, unfortunately, because I'm the host of this presentation. So, I mean, maybe now, but you can tell me. But so let's get, sorry. Good. Okay, let's get started with the shoulder. So that's a common reason why some people have some pain. One of the reasons could be due to a lack of shoulder stability. So what is shoulder stability? I know it's been thrown around a lot. So let's talk a little bit about anatomy. Your shoulders are naturally a very mobile joint. It needs to be mobile because it needs all the freedoms of movement so that when you kind of go try to pick something up from a shelf or you try to reach something from the back of your seat of your car, if you're doing an overhead press, it creates that mobility that you need. But when something's really mobile, you also need some stability. So if you think of this as your shoulder joint, if it moves too much here, it can cause some pain. So that's kind of where the rotator cuff comes in. Think of the rotator cuff as 4 muscles that act like a compressive sleeve on your shoulder, so that when you bring your arm up, it doesn't rotate, it doesn't move too much, and it stays nice and tugged in. So when someone has rotator cuff strength deficits, when you're doing something that's weight bearing, you can imagine that thing, like something that's dynamic, like a weight bearing exercise, can cause some pain in the shoulder. So a potential solution, I don't want to say is the solution because it really does depend on what you have, but a potential solution is an exercise, doing accessory work. So you can do wall slides, one of my favorites, which is really getting a bend around the wrist and going on a wall and just pushing upwards. You can also do a bottoms up kettlebell hold that Nava has shown, which is just holding your kettlebell in the reverse way and just stabilizing it right over here. Second, it could be just technique. So depending on how you do it, I commonly see people doing push-ups in this way. And one of the reasons why I'm not a huge fan, I mean, like there are some variations that are wide grip, which is okay for the advanced athlete. But if you're a beginner, I'm not a fan of this, primarily because it can cause some impingement. As you can imagine, you're going and you're weight bearing into this position. It can cause some pain on your front of your shoulder. So an easy way to kind of fix this is just alter technique. So as you can see on the picture on the right here, Nava is showing how basically what we were showing in the beginning slides, hand positioned on their shoulders and elbows not flaring.
Sorry, Tina, can I just stop you for 1 second? We just had
Yes.
just good participation all day, but LC in the group chat just asked, could you describe what a push-up plus is?
Sure. So a push-up plus is basically the end of a push-up. So if you can imagine, I'm going to show you, it's really hard. So when you're doing a push-up here, you're almost pushing up this way, but you don't want to push with your pecs. You want to push in something what we call our serratus muscle. So it's really trying to even get that mind muscle connection. Sometimes can be a little bit hard, but it's just imagining pushing in the area around this, and then you're just doing end range like this, if that makes sense. So you can do that on the wall, or you can also just do that on the ground. Does that answer the question?
Sorry, I had to take myself off mute again. I don't think they could see you because they had the screen up.
Oh, they can't. So how? I don't know how to show it. Okay, so I'm just going to explain it. Sorry, I thought you could. You haven't been able to see me this whole time. I've been showing things.
Let's wait till the end in the Q&A, and we can take the PDF down. We can show everybody.
All right, but are you not able to see me because I've been showing things this whole time? No?
Exit screen.
You can't see me?
No.
Oh, wow. Totally did not know that because I've literally been demonstrating things this whole time. Okay. Okay. So we'll talk about this a little bit more later on then. But thank you for the question.
Okay. Some people have been able to see you. It depends on what. Yeah, guys, if you're watching that little icon button, you should be able to, it's the third button in. You should be able to see everybody's video, not just Nava, who is standing there. But for everybody else, we'll redo the push-up plus at the end.
Yeah, and we can also redo the external rotation torque because that is what I demonstrated. So yeah. Okay, we'll go on. Okay, let's talk a little bit about the elbow now. So common region of pain. One reason could be the technique, so the way that you're doing it. So oftentimes people get elbow flaring. So that's kind of something like this. And that can happen when you're kind of going into the downward position as well as when you're going in the upward position. Now, one reason that can happen is because you're doing it too fast. So research has shown that if you're doing a push-up really fast, that can cause more elbow flaring out and create more elbow shearing. Now, to prevent this, research has shown that if you decrease your tempo, so going a little bit slower, it will create some control. Secondly, it can be due to fatigue. So I don't know if anyone has ever noticed this on themselves, but I sure have. After doing potentially maybe 15 push-ups, maybe the 10th or 11th push-up, you do really great form. And after that, you notice that your core maybe is not engaged if your core is weaker, and it becomes fatigued easily. And what ends up happening is you kind of prop forward more with your shoulders, and then your elbows just flare a little bit. So a simple solution for this, for some people, can be just decreasing the tempo. So going a little bit more slow, going in more control, and that will reduce shear forces at the elbow joint. You can also fix technique. So shown at the other side, I don't know if you guys remembered, but that foam roller where the forearm is, not only will it allow you to have a straight forearm, but it also it'll give you some cues and tell you whether you're flaring your elbows. Also, if it's due to fatigue, and let's say you're only able to do 3 good quality push-ups, but after the 4th rep, you are noticing that your elbows are flaring, I suggest actually regressing it a little bit and do more upper body exercises, because you want to, create that proximal tension throughout and do good quality push-ups so that you don't end up getting this and you don't end up getting elbow pain. Another reason why you may get elbow pain is due to positioning. So research has shown that if your hand's a little bit more wider, it can cause some elbow shearing, and I have posted the author over here. If you guys want the article, just send me an email, or I can post it right after this, as well as if your hands is positioned a little bit higher above you, is what we call superiorly. And a solution for this is narrow hand position. So just narrowing your hands, similar to what we've shown in the previous slide. Also your neck position. So could be hyperextension is what we see here, and forward head position. I mean, Nava has explained that a little bit in detail, but just to summarize, when your head is in extension, that creates some compression in parts of your neck, and the stability muscles of your neck are not able to work as it should. Same with your head and being propped forward. So the first one, neck extension, I know people typically do it because they want to see what's in front of them. And then the one in the second picture, as you can see here, maybe people do it because one, they don't want to stabilize their muscles of their neck, or they want to look, I'm not too sure, the core or something. But for whatever reason, I've seen this happen where some people just leave their head forward or down. So ideally what you want to do is have that neutral line right over here. So that line allows you to it allows the spine to also be in a neutral position. So you want your eyes looking down, and this is a really good position when you want for your neck and not have any neck pain. So a solution for this is to fix technique, as well as strengthen your deep neck flexors. This will always help. So as you can see the picture over here, we call one of the exercises strengthen the deep neck flexors, a chin tuck. So I don't know if anyone here is an office worker, or especially working from home. Maybe you have your laptop on a table somewhere, and your position is more like this, and your head is more like this, and then you text a lot and your heads are more like this. So when your head's like this, your deep neck flexors are actually lengthened and they're weak. So that stability of your neck may be affected. So to strengthen your muscles around the front of your neck, you can simply just do chin tucks. This will not only help your neck positioning when you are doing a push-up, it will just help you on your day-to-day life to not have neck pain.
Tina, can you describe what lordosis is? That was a question in the chat.
Oh, sure. Yeah. So lordosis is the way that your spine is shaped. For example, your neck has a little bit lordosis. So as you can see, this gentleman over here on the picture has a lordosis, a little bit of lordosis, which is a curve in this way. Your back also has lordosis. So it's a curve in this way. Your upper back, sorry, I meant your lower back has a lordosis. Your upper back actually has the opposite of it, what we call kyphosis. Does that make sense?
Yes.
Awesome. Great. Great question, guys. Okay. Now, the last, I guess, region that people get pain is the wrist. So one reason could be due to a lack of stability. I'm not too sure how many people out there have lots of mobility in their joints. Maybe they're double jointed. Really good way to do party tricks, maybe. Maybe you have lots of flexibility like Nava, who used to be a figure skater, and it becomes really, it's a great way to help with your figure skating and make you a great athlete, right? But unfortunately, when you have too much mobility, but you don't have the stability, you can lead to some pain. So also another, I also have hypermobility in my wrists, but the rest of my joints are completely fine. And the way that I can help, the way that I've been trying to help my wrists, because I do Olympic weightlifting and that requires lots of load on your wrists, and the wrists are really small. So what I've been doing is wearing a wrist strap when I do any of my lifts, and it has helped a lot. So a wrist strap, as you can see in the picture over here, it kind of creates that compression, similar to what I said about the rotator cuff, but it just creates that compression of your wrist so it's in a good stable position. So that's something to look into if you have that hypermobility problem like me. Secondly, you can strengthen your forearms, or any type of strengthening to kind of strengthen your grip can help. But you can also just do joint stacking, so neutral grip. Also, as you can see in the picture, right on the right here, where my arrow is showing, his wrist position is stacked. And what stacked means is if you can look at the wrist, there isn't just one joint of your wrist, there's 2 layers actually. And these layers are stacked as if it's like a foundation of a house. So it creates that stability because it's stacked right on top of each other. So that can help if you are experiencing some hypermobility in your wrist, too much mobility, and it's causing you some pain. Secondly, it can be due to poor technique. So excessive weight maybe in one part of your wrist. And the reason could be that maybe you're just not distributing it for some reason. I'm not too sure, but so some people who have more pain on one side of the wrist than the other, that could be a reason. So a solution for this is just really simple. Distribute your weight equally with your fingers spread out. Fingers spread out, but they're active, right? They're not just passively falling on the floor. You're actively gripping the floor. Next, yes, sorry.
Is there any way for somebody to know if they're double jointed or if they're hypermobile?
Yes, actually, I think it's called the Biden score. So it's, if you want to YouTube it, it's the Biden, and depending on what grade you have, you can determine whether you are more hypermobile. But yeah, does that answer your question?
Maybe you can type it into the chat at the end of.
I'll type it in. Yeah, just remind me. But that will determine whether you have hypomobility in, like, you're generally a hypomobile person. If you are experiencing hypomobility on your wrist, just like me, you kind of need to, like, a more thorough assessment for that. So yeah. Okay. So thirdly, it can be due to a lack of mobility. So opposite of hypomobility, a lack of mobility. So you don't have that wrist extension. So push-ups need about 85 to 90 degrees of wrist extension. So this is extension. And a common reason why someone might not have that wrist mobility could be a previous wrist fracture. If you can imagine you falling on an outstretched hand, you have a wrist fracture, now you're in a cast for whatever, 6 weeks to 8 weeks, whatever it is, and now your wrist becomes stiff. If you don't have the rehab to kind of increase back that wrist extension, you may be stiff for long term unless you do some wrist mobility. Some people just have less wrist mobility in the wrist for whatever reason. Could be due to a different kind of injury. But depending on what it is, you can also try to improve your wrist mobility via exercises that Nava is going to show, as well as just having your neutral wrist position. So the reason why it hurts when you don't have the wrist mobility and you're going into that extension is if you can think about your weight bearing on a really small joint, and if there's not enough room in your wrist, you're forcing it into a room that it doesn't have, and that's just going to signal pain, right? But Nava's going to talk about that in a little bit more.
Okay, so again, like Tina mentioned, our wrist is the smallest joint that goes up the entire kinetic chain. So it's smaller than our elbow and it's smaller than our shoulder. So it will typically take up quite a lot of load when we are doing push-ups because, again, we're putting it through its end range position. Okay, so we want to make sure that we're taking good care of them. So in the next slide, we'll go over an assessment. So again, this is just one example of what you can easily do by yourself at home. So again, you can check to see if one side is more limited than the other, especially if you're having one-sided wrist pain. So again, start off in a 4-point position and make sure that the bottom of your wrist keeps good contact with the floor at all times. Then once you're in the starting position, slowly shift your weight forward to see how far you're able to move your shoulders. And again, you can see over here, I have about 100 degrees of wrist extension. So for the push-up, you need, again, around 90 degrees of wrist extension, like is shown in the picture on the left-hand side. If you don't have this mobility, or if you're resting in this position and it's a little bit uncomfortable, then you can try to just incorporate the following exercises or modifications into your routine. The first exercise is wrist rocking. So you can use this to improve your mobility or even just as a general warm-up exercise. Similar to the assessment, you start off in a 4-point position with your fingers pointed forward, and then again, gently rock your body weight back and forth. Then you can point your fingers more outwards and then rock your body side to side. And then lastly, you can turn your fingers so they're pointing towards you and then rock back and forth again. The exercise on the right-hand side gets a little bit more specific and allows you to improve your range of motion when you're trying to get kind of like that last little nagging bit of mobility that is just not improving. So what you can do for this is tie a resistance band and wrap it around the bottom of your forearm bones. So you'll kind of see the pokey, like the pointy bone over here. So put it directly underneath that and get the band to pull you backwards almost while you lean your body weight more forwards. Again, similar to the assessment technique. And throughout the entire exercise, make sure that your palm is keeping contact with the ground. If you want to take it a little bit of a step further, you can add a little bit of a distraction. And again, it's not shown in the picture, but what you can do is just place your other palm on top of the hand that you're trying to mobilize, just to add a little bit of a downward force to the floor. Okay. So again, if you want to continue doing push-ups while you're either still improving your range of motion or you're having a little bit of wrist discomfort, you can try any one of these 3 variations. By doing push-ups in more of a neutral grip position, it will, again, put a little bit less load on the wrist compared to the conventional push-up where, again, you're all the way back here. So the first image on the very left-hand side shows towels placed underneath the palm. And again, this will decrease the amount of wrist mobility because instead of having to be here, I can now maybe just place my wrist in this position. The next one, the image in the middle, just shows a fist push-up. So again, this allows you to keep a neutral wrist position. So again, it's nice and straight. And these are actually way easier than they look. You can also put a towel underneath your knuckles just to make it a bit more comfortable for yourself. So again, like Tina kind of mentioned, I do have right-sided wrist pain sometimes. And when I do push-ups, I like to do fist push-ups like in the middle picture because it just helps stack my joints a little bit better and I feel a bit more stable. And the last variation that you can do is, again, just holding onto dumbbells. It can be any type of dumbbell, just as long as there's enough height so your knuckles are not touching the floor.
Okay, let's look at this part, the regressions. So how many of you guys have been doing push-ups on your knees? Go ahead and put that in the chat box below. So let's talk a little bit about push-ups on your knees. You can do them, they're okay. I'm just not a huge fan of them, and I'll tell you in a second. The reason why I'm not a huge fan of them is because it affects the way that you're positioning and creating that proximal tension. So when your knees are bent and you're doing a push-up on your knees, your pelvis is in position in a place where you can't really engage your core, create that neutral spine, and engage your gluteal muscles. So when you want to do push-up, you want to attain everything that we've kind of explained in the previous slide, creating that proximal tension throughout. So a great way to regress a conventional push-up on the ground is simply just doing an incline push-up. So as you can see in the picture here, Nava's hand is on an elevated box and she's still creating that proximal tension, everything is nice and engaged, so that when she kind of goes down into that position, it's very similar to a conventional push-up. And when something's really similar, it'll have really great transferability. So here, you want to ensure that your body is no more than 45 degrees away from the ground, as this can alter your shoulder mechanics. So eventually, when you are doing really well with an elevated surface, you want to eventually reduce the angle to eventually do push-ups on a flat surface. But of course, that's ultimately what your goal is, if that is your goal, sorry. So I personally like using the 60% rule. And what 60% rule is, once you've achieved 60% of any particular stage of progression, is probably appropriate for you to go to the next stage of progression. So let's talk numbers here, because I know a lot of people may be understand a little bit more with numbers. So for example, you are at the 45-degree incline surface like Nava over here, and your goal is to do 10 push-ups. You're now able to do, after lots of practice, now able to do 6 really, really great push-ups, and just like here. But the 4 is not so good, but it's still okay, but it's just not so good. But still, that's an appropriate time for you to progress. So reduce the angle and get it, and maybe go to 25 to 30 degrees, whatever you want, and start doing push-ups on that incline. Now, that does not mean that you stop doing push-ups at 45 degrees. You eventually want that 6 out of 10 good push-ups to be 10 out of 10. But doing that 60% rule, when you kind of go to 30 degrees, it allows your body to kind of be more challenged consistently. So eventually you will hit the conventional push-up on the ground a lot faster, if that makes sense. Many, many, many progressions. The list goes on, but here's just a few of my favorites. So you can increase the decline. So as you can see here, Nava's foot is propped on an elevated surface and she's doing a push-up, still maintaining all that proximal tension that we were talking about earlier. So the reason why it's a lot harder is because now Nava has to support a lot of her body weight. Okay. And now you can add instability. You can, as you can see in the picture, you can add some rings, really good for your serratus, really good for your shoulder stabilizers, as well as a Bosu ball push-up. You can change the tempo. You can make it a little bit slower. So time under tension can really help with strength. Now, any of you guys who are working at home, don't have access to dumbbells, a really good thing to kind of take out from this presentation. If you don't have any weights or at all and you're doing squats, for example, and you want to make it a little bit more difficult because baby body squats are a little bit too easy for you, what you can do is either when you're descending on a squat, for example, you want to go a lot slower, or you can hold it at a position and just hold it there. And I promise you'll feel the burn. So it's similar to a push-up. If you go a little bit slower, like you might see in push-up challenges, maybe that are matched to a song, for example. I'm not too sure if you guys seen it. It's a really easy way to kind of make the push-up a little bit harder. You can also add weight or bands. So obviously now this gentleman over here is doing a push-up on a more load, with more load, so it's going to be a little bit harder, as well as the band to kind of create that tension. Obviously the possibilities are endless. Many advanced variations. So we already discussed the diamond push-up, which is the push-up here. It's more advanced variation. Obviously, I would prefer someone who is more experienced with the push-ups to do this exercise. Sorry, that is my dog. Oh my gosh. Okay, moving on. You can also do the single arm push-up as well as a plyometric push-up. A plyometric push-up is basically a push-up with speed. As you can see here, it's speed and power. As an Olympic weightlifter, I actually incorporate this as part of my own routine because it helps me with jerk. So jerk is requiring some powerful movements overhead, doing a plyometric push-up because a jerk is essentially a push exercise, and the push-up being a foundation of the push, it actually helps me create that power as well. There's also the pike push-ups as well as the handstand push-ups. Handstand push-ups are really popular in either the CrossFit community as well as the calisthenic community. Okay, this